So before we get started talking about gut health, I want to just give you a little introduction into what naturopathic medicine is, because I know a lot of people aren't fully familiar with that. So naturopathic medicine is individualized and integrative healthcare. We believe that health and disease are multifactorial and that treatment should represent this, and that each individual patient needs specific treatment. We like to investigate and treat the root cause of symptoms and conditions. And then a lot of our treatment modalities are varied. So we utilize things like lifestyle modifications, diet changes, nutrient supplements, botanical or herbal medicine, physical medicine, homeopathy, and pharmaceutical medications. We're always trying to think of the least intervention first. So utilizing the things that are simple and easy on the body before going to more extreme measures like pharmaceutical medications or surgery. I like to show people the 6 principles of naturopathic medicine just so you can get a better idea of our philosophy. So our first principle is to do no harm. Our second one, like I said, is to identify and treat the cause of disease rather than just putting a Band-Aid on symptoms. We always thinking about treating the whole person, so treating the mind, the body, and the spirit. We utilize the healing power of nature often, so we're using the things we find in nature as well as enhancing the natural capabilities of the human body. We believe that the physician should be a teacher, so doing things like webinars or when patients are in the office describing what's going on in the body, helping patients to understand the physiology and how treatment will help. And then our huge focus is on prevention. So we really want to catch disease or catch potential progression to disease before it's in that actual manifestation of a disease state. So what is gut health? This is a great question. It's such a buzzword these days. And so I kind of want to just give you a brief overview of what I think gut health is and why it's important. When we talk about gut health, we're really talking about the whole entire gastrointestinal tract. And that starts in the mouth and runs through the body out the other end, and it can actually be up to 30 feet long in adults, which is a fun fact I like to tell people. I think that's pretty insane that all fits inside our bodies. We start a gut health assessment with taking a detailed patient intake, getting a good look at what symptoms a patient may be dealing with and what their medical history is, and we often utilize functional lab testing. So that could entail food sensitivity testing, a comprehensive stool test, and other lab work, like just basic blood work. What we really are assessing when we're looking at gut health is the digestive capability of the body, whether you're able to absorb vitamins and nutrients, whether elimination of waste is happening properly, if there's an inflammation in the gut or activation of the immune system, and whether the microbiome is imbalanced. The microbiome is another great buzzword, and I think a lot of people have heard about the microbiome and they've heard about probiotics but aren't quite sure what it is. So basically the microbiome are microorganisms that are living in our bodies, on our skin, in our mucous membranes, in our mouth, and in our digestive tract. And they're comprised of many more microorganisms, including bacteria, viruses, yeast, fungus, and protozoa. Many of these microorganisms are actually beneficial to our bodies because we evolved with them through time. And so they actually help us to break down and absorb nutrients and minerals, and they synthesize some of our vitamins and enzymes and help us to detoxify. So when the microbiome is in balance, it's actually very helpful to our health. I like to kind of give patients an overview of what the digestive process looks like. So I'm going to use my cursor here. So basically when you eat food, digestion really starts in the mouth, and this is an area that's often overlooked. Chewing is so important. So chewing helps to break down our food, and it also helps the saliva and enzymes to mix with our food to start that digestive process. A lot of us chew our food like 2 to 3 times and then we swallow, and we should really be chewing 20 to 30 times or until there's no flavor left in the food, which sounds like a lot. And I admit I myself often don't chew that many times, but it's really important to be mindful about this area because it really sets the rest of the digestive system up for success. So then the food will move down the esophagus into the stomach, and this is where hydrochloric acid is released that helps us to break down proteins. The food then will move into the small intestine where bile and digestive enzymes are released, and this will help us to break down further proteins, carbohydrates, and fats. The nutrients will then be absorbed in the small intestine, which is this orange area here, and any leftover waste products will move into the colon or the large intestine, which is this green part right here. The large intestine is responsible for reabsorbing fluids and also is the house of the microbiome, like what I was just talking about. So it's really important as well. Okay, so I'm going to move on. When there is imbalance in the gut, there's a lot of different factors that we're looking at that's causing the imbalance. So a big one is inflammatory foods. And this is so prominent in today's society. We eat a lot of foods that are high in processed sugar, refined flours, pesticides, things like that. And people also can have sensitivities to quote unquote healthy foods. So that's where food sensitivity comes in, and it can be helpful. When our body's reacting to a food in the gut, it will cause inflammation. Another thing to be thinking about are toxin exposures. This can happen from pesticides, from things like high mercury fish. We're looking at medications and antibiotic usage. A lot of my patients have had multiple rounds of antibiotics, and while antibiotics are really helpful for getting rid of pathogens in the body, they also impact our healthy microbiome, our healthy bacteria within our gut. Stress is a big piece, and this is another one that's often overlooked. When we are in a high stress state, we shut down our ability to digest food. We shut down the blood flow to the digestive system, and it really compromises our ability to digest food, often leading to things like gas and bloating or symptoms of irritable bowel syndrome. Trauma, physical or emotional, can impact the gut. Lack of exercise, poor sleep, and inadequate hydration. Hydration is really important. It's really important for things like constipation and just adequately hydrating all the cells in our body. And we like to aim for half our body weight in ounces a day. When we talk about symptoms of gut imbalance, there are so many, but a lot of people will think of this left column, symptoms that are localized to the gut itself. So I'm just going to go over all the symptoms that could potentially be signs of gut imbalance. So in the GI itself, there could be abdominal pain, bloating or distension, gas and gas pain, cramping, indigestion, acid reflux or GERD, constipation or diarrhea, anything like blood, food, or mucus in the stool, and cravings for sugar could be a sign of candida or yeast overgrowth. Conditions that are commonly talked about are SIBO, or small intestinal bacterial overgrowth, and the tail sign of this is having lots of gas and bloating and distension. Leaky gut or intestinal hyperpermeability is another big buzzword, and basically what that means is that the intestinal cells and the barrier of the gut lining has become leaky, and it's allowing larger food particles to get into the bloodstream and activates the immune system. Down the line, this can lead to things like joint pain or autoimmune disease. IBS, as mentioned, inflammatory bowel disease like Crohn's or ulcerative colitis, GERD again, so acid reflux into the esophagus, causing that burning sensation after eating, stomach or stomach ulcers. And then outside of the gut, we're looking at things like autoimmune disease. A really common one is Hashimoto's thyroiditis, and one of the biggest triggers for this is gluten. So that's like another way of food sensitivity could be activating different symptoms in your gut and in your body. Rheumatoid arthritis is another big one. Skin conditions such as eczema, rashes, or acne. Mental health conditions such as depression or anxiety. The gut is always in communication with the brain, and so that's where these come into play. And then other random symptoms that seem unrelated, like fatigue, brain fog, headaches, joint or muscle pain, and weight gain. In terms of treatment, or the ways that we often heal the gut, we think of the 5R approach in naturopathic medicine, as well as functional medicine. The 5 R's are remove, replace, replenish, repair, and rebalance. So to start, what we're doing is we're getting a really good intake medical history, seeing what could be causing imbalances in the body, and utilizing those tools like food sensitivity testing and stool testing to see what is causing stress on the body. So the first thing, some of the things we're thinking about in terms of removal would be food sensitivities such as gluten and dairy, processed foods like sugar and alcohol, toxin-heavy foods, like I mentioned before, foods heavy in pesticides, high mercury fish, unfiltered water. Unfortunately, our tap water is pretty polluted. Pathogenic organisms, this is something that would come up on a stool test, like bacteria, yeast or candida, parasites, and even viruses. The next step, or number 2, is replace digestive capacity. This is really important for downstream effects within the gastrointestinal tract. This is our first line defense. So in that stomach, we have the stomach acid that's helping to break down any potential pathogens. And then we have our digestive enzymes that it's helping to break down food as well as the hydrochloric acid. And so what we would do is replace them naturally and with the ability of our body to increase itself with things like ACV and bitter herbs, or we would use a supplement like hydrochloric acid, digestive enzymes, and ox bile. ACV is apple cider vinegar. Number 3 is replenish. So we're thinking about replenishing the good bacteria. So this is where probiotics would come in, and probiotics can be used as a supplement or just in fermented foods and things like kombucha or yogurt or kefir or sauerkraut. And I really recommend patients have some of these fermented foods in their diet every day. And another thing that's often overlooked are prebiotics. So this is soluble fiber, which are fuel for the bacteria itself. You can find soluble fiber supplements, but also this is what you would find in just fruits and vegetables. Number 4 is repairing the intestinal lining. This part is really important, especially if a patient's presenting with something like leaky gut. And the way we do this is utilizing whole foods that are dense in nutrients and vitamins and minerals. We utilize things like collagen or L-glutamine, zinc, vitamin D, and short-chain fatty acids. Short-chain fatty acids are actually produced by healthy microbiome itself, and they act as fuel for the colon cells, but we can use this in supplement form as well. The 5th R is rebalance, and this part is really important as well. So this is where all the lifestyle factors come in. Things like reducing stress, increasing exercise, optimizing sleep, drinking plenty of filtered water, and really making an effort to participate in nourishing activities, things that feel really good to us and our bodies, activities that give us joy, passion, and a sense of well-being. Why is healing the gut important, or what would be a benefit of healing the gut? So when we heal the gut, we're really setting up the foundation for optimal health. If you can think of the gut as our first line defense or barrier to the outside world, and the gut lining is really thin. It's only 1 cell thick, so it's easy for that barrier to be compromised. And a lot of the immune system lives within the gut. This is a hot topic right now with everything that's going on. And so when you heal the gut, you're really strengthening the immune system. We're also helping to strengthen other systems like the nervous system, cardiovascular system, the ability to metabolize and create energy. When we heal the gut, we are also able to normalize digestion, and this leads to proper nutrient absorption and distribution to all of the cells within our body. When our cells have all the components they need for optimal health and functioning, we're able to produce energy and feel vital and energetic throughout the day. And we're also able to remove waste and toxins from the body. Healing the gut helps us to reduce inflammation within the gut itself and also systemically throughout the body, which will really help us to reduce and potentially eliminate symptoms and conditions and chronic disease overall. So I wanted to give you just a brief look of what a food sensitivity test would look like, because it is something that I run with a lot of my patients and I find it really helpful. So a food sensitivity is different than a food allergy. We're looking at this marker over here called IgG, rather than the marker for food allergy, which is IgE. A food allergy is what you get ran at your conventional doctor's office, and that's something like anaphylactic shock, eating peanuts and your throat closing up. A food sensitivity is much more subtle, and it can also be delayed, and it can be symptoms like I've mentioned before, like gas and bloating, things that are localized to the gut, and it can also be other symptoms like depression or brain fog or fatigue. When we run a food sensitivity panel, there's different options in terms of price and how many foods you want to look at, but it's all broken down into different categories. So this picture right here has dairy and vegetables. And they rate the sensitivity from 0 to 4, 0 being no immune activation and 4 being really high. And so when foods are coming up like this cottage cheese that's in this really high activation range, anything above the 3 and 4, and potentially for some patients even in the 2 range, I'll ask them to eliminate the food for a period of time while we do gut healing, and then reintroduce the food and see if it's a true sensitivity. Things that are in the 0 to the 1 range, we typically have patients rotate with their diet, eating about every 4 days. Another thing that can show up on a food sensitivity is where tons of foods are showing up, and this would be another sign of leaky gut. And so it doesn't mean that you have a true sensitivity to all these foods and you'll never be able to eat them again, but it does mean that there needs to be some healing and some gut restoration to decrease that immune activation. This is my contact information. If you don't have any questions yet, or if you want to ask me questions later, you can send me an email at drmyers@coywell.com.